David Goldhill's father died of a hospital-acquired infection. After the experience, Goldhill tried to find out why markets don't work properly in healthcare. He published what he discovered in the Atlantic Monthly's September 2009 cover story, How American Healthcare Killed My Father.
We all are used to this idea that healthcare is something of an island. It's not a good or service like all the other things we buy are, like all other things are. It's not subject to the same laws. When we need it urgently. There's no real choice. And we have created a system that really enshrines that the healthcare is funded differently, it's accounted for differently, it's every aspect of it is. And part of it is, of course, that healthcare is a system where most expenses are paid for, at least partially, by somebody other than the consumer. One of the questions I ask in my article, and really it is the fundamental question that an outsider should ask, is healthcare an island because it must be an island, it must be different than everything else? Or is it an island because the assumption that it's different from everything else has caused us to do a lot of things in the way we fund it, in the way we regulate it, in the way we hold it accountable, that have separated it more from the rest of what we do, the mainland of our economy, if you will? You know, my answer is healthcare is less different than we think it is, but we've made it more different than it needs to be. And that cost is extraordinary, not just in terms of money, although in money it is obviously astronomical, but also in terms of quality and the signals that exist in any system. Any system is complex. We talk about healthcare as if it's one product. It's the largest series of products and conditions and treatments imaginable. But those signals are missing that explain why we see things like poor adoption of information technology. I joke that this hospital, was less computerized than my dry cleaner. And it's a true statement. My dry cleaner is concerned enough about losing shirts that he's fully computerized, and the hospital is not as concerned about losing lives. Why is that? Well, why weren't those investments made? Why do they need to be made by the government? We talk about an unrelenting rise in prices, which we talk about as costs, in healthcare, which hasn't occurred anywhere else in our economy, even though many of the inputs are the same. We talk about technology driving up costs in healthcare when it's driven down costs and improved quality everywhere in our lives. Now, you can take the position, at this point feels like an almost religious position to me, that, look, healthcare is just different. It can't be compared to anything else. And maybe that's right. But I think it's much more valuable to say, what have we done to healthcare so that all the benefits we could have gotten out of technology, massive increases in productivity, all of the things we've learned in the rest of our economy about how to provide better quality, better service, be more aware of the specific needs of the individual consumer. Why haven't those things occurred in this thing that's now almost 20% of our economy? And I think if you approach it from that latter perspective, you come up with very different answers. Well, I think a lot of people who talk about information technology in healthcare are not as familiar with how it works outside of healthcare. The reason my local sushi bar gave its waiters handheld ordering devices was not because of the National Sashimi Act passed by Congress. That act didn't pass. It's because they want to get the orders right and quickly. They capture some of that benefit, and by the way, the customer captures some of the benefit, right, of that fairly simple thing. The lack of information technology investment in healthcare is not the problem. It's a symptom. Throughout the entire rest of our economy, no matter how prosaic, how simple the business, or how complex the business, information technology has revolutionized service, quality, and cost. The fact that in healthcare you can have things such as a RAND study that says we spend $40 billion in information technology, we're likely to save $35 billion a year, maybe more, is treated as, oh, so that's the answer, let's spend $40 billion on information technology, instead of what it really is, which is, what kind of industry with an 80% return on capital isn't making the investment, and why? Information technology is all about application. It's not about putting a box on someone's desk. It's how they're used. What the lack of investment in this industry, and this industry pretty much alone among all industries, tells you, is that nobody is in an economic position to capture the benefits of higher quality, lower costs, more portability of records. Why is no one in the position to capture that? We have a supposedly private sector healthcare business. or industry, I should say, or industries. If you have a symptom that screams, nobody benefits enough from this to invest in it, you better figure out what the underlying disease is before you throw a bunch of boxes on people's desks. And unfortunately, the reaction has been more, oh, we spend $40 billion on healthcare technology, there's $40 billion of savings a year. That's not what's going to happen. The same people who weren't incented to benefit from quality service and lower costs are still not incented to benefit from those just because you threw a box on their desk. Well, insurance is another case where healthcare is an island. Insurance is a financial product, right? It's a way of financing something, really spreading risk. And throughout the rest of our economy, insurance is used for things that are rare, unpredictable, and major. That's it. You can't insure against ordinary expenses or things you can plan. Even life insurance, you're not insuring against dying, you're insuring against dying young. And that's important because insurance is very expensive from an administrative perspective and involves enormous amounts of moral hazard, which is when you have insurance, you're more likely to engage in whatever it is you're insuring against. And if you don't, this is known throughout everything, which is why you can't get redecoration insurance for your house because you'd redecorate every year. Now, in healthcare, insurance has gone from what it started out being, which is protection against the very rare, very major medical events that can change a family's financial and obviously physical well-being, to something we now use to fund basically every expense. In fact, when people talk about healthcare, they increasingly are talking about health insurance. How many times have you heard a politician say 15% of the country has no health care when they mean they have no health insurance? Unfortunately, all of the perverse effects of insurance that explain why it's not used outside of healthcare for anything but the catastrophic take place in healthcare because we use it for everything. Look, I can tell you, I've been uninsured and insured throughout my career. When I'm uninsured, I am very careful about what I spend. I negotiate with doctors and providers. I demand to see the bill ahead of time. I want to know what something charges. When I get referred for a procedure, I want to know that it's the cheapest procedure, not just the one owned by the doctor. And when I'm insured, I don't care. And I can admit that for myself. It's not a matter of, as many think, look, you have no choice whether or not you get cancer. If you get cancer, you need care. That's obviously true. But at the margin, and the margin's very, very big with healthcare, insuring everything takes away one of the key disciplines in healthcare and in anything else, which is a consumer who's paying attention to price. I have negotiated tons of healthcare treatments I've had when I'm uninsured, and I can tell you that this is a system that relies very heavily on somebody else is always paying. And many of us, when we go to the doctor now, we ask the doctor, not what does it cost, but what's my share? And what's my share leads to very different decisions. We know there's a lot of excess health care in this country. I've seen estimates anywhere from 1/4 to 1/3 of our health care is unnecessary. And by the way, unnecessary doesn't just mean a waste of money. It also means subjecting people to procedures, all of which have potential complications and potential side effects that are negative. What is going to get that extra care out of the system? Governments haven't done it. Insurers haven't done it. Employers haven't done it. The way it works the rest of our economy is insurers have a little more, individuals, have more skin in the game. They're the only ones who probably can bring that discipline to the system.
David Goldhill is CEO of the Game Show Network and author of the Atlantic Monthly cover story, How American Healthcare Killed My Father. His October 1st, 2009 Capitol Hill briefing is available for download at cato.org.